So we've got, this is the trachea, okay? You can see the nice cartilaginous rings there. And then up at the top, it's a little bit hard to see. It's not as prominent as it is in the cat and the pig. The pig's larynx is really like a big expansion, but the larynx in the cat is right there, and it's a little bit harder. Clear some of that extra connective tissue away. Okay, but this right here, that's the larynx and the trachea. Posterior to the trachea is the esophagus. Okay, nice smooth muscle. That will lead down to the stomach. Once we get in here, you can actually see the thymus gland here. It's right there. It's a little bit different texture, a little glandular. The pericardium is nice and intact here. So this outside would be considered the parietal pericardium, and then the inside layer, so that's parietal. And then this inside layer would be the visceral pericardium, okay? They're gonna remove their heart, and when they remove it, they'll get to see the bronchi branch to the lungs. So this is the lung here, and then the other lung right there, okay? This muscle here is the diaphragm, okay? That separates the thoracic cavity with the abdominal pelvic cavity. So the thoracic cavity would be superior, okay? Abdominal pelvic cavity would be inferior, okay? The liver is here with the various lobes. This right here, that's the gallbladder. That little, looks like a little deflated bag or a balloon, okay? Some of them are a little bit more green.
Yeah.
Okay, just depends. Okay. All right, now we have the stomach here, and I do want you guys to cut it open and maybe clear out some of the stuff inside. Okay, so you can see the rugae. The rugae is really clear, not as clear on the pigs, because the pigs, the stomach seem to be more distended. Okay, so you're not going to see the rugae, those wrinkles on the inside, as much as you will on the cat. Okay, but there's the stomach. Posterior to the stomach is the pancreas. You can see the texture is quite different from all of the organs around it because it's a glandular, made up of glandular epithelium. The pancreas. Remember, the pancreas is going to secrete digestive juices into the duodenum, which is the first part of the small intestine. The liver will produces the bile, which gets stored in the gallbladder, and then that gets released into the duodenum as well. Okay, so right here, this is the stomach, and this is the duodenum. This is the first part of the small intestine. Okay, and then the small intestine all right here. So that this part is like the jejunum, and then right here at the end, we have the ileum. Okay, where my thumb is, this thumb right here, now the pointer finger. Okay, or my index finger, pointer. Okay, so this would be the ileum. All the membrane that connects and kind of supports and nourishes the small intestine, this is the mesentery. You can see the veins or the blood vessels in there. There's nerves and lymphatic vessels in there as well. So it's there to kind of support and stabilize the small intestine, okay? So right here where the small intestine and the large intestine join, that is the ileocecal valve, okay? You can't see it, we'd have to cut it open. And then this part of the large intestine is called the cecum, okay? And then this will, again, they don't have a ascending, transverse, and descending sigmoid colon like we have, so this large intestine is just large intestine or colon, and it leads down to the anus, which would go over here, okay, which is back here. All right, kidney, there's one kidney there. Kidneys, remember, are retroperitoneal. Any membrane that is in the abdominal pelvic cavity we refer to as peritoneum, or it's peritoneal, okay? So surrounding the organ here would be visceral peritoneum, right there. And then we can see, so this kidney, we can actually, if you guys want, you can kind of go around and pop it out. But we know that the kidney produces urine, and the urine will then get transported via the ureter to the urinary bladder. So this is the bladder on the cat right here. Okay, and that ureter leads directly there. Kidney on this side, again, we could kind of pop it out, clear some of this fat away, and you'd be able to see the ureter leading from this kidney to the bladder. Okay. Let's see, this is a female cat. This right here is the uterine horn. So like in the cats and pigs, they carry multiples. So they don't have one uterus, they have uterine horns. So this is the uterine horn here and here. At the end, you'll see the little ball. That's the ovary right there. Ovaries produce eggs. And then here is the ovary there and the uterine horn. In the pig, it looks like a little curlicue, like a little ribbon. Okay. And then this will connect here. It'll join. That's still part of the uterus. And then down further, we'll have a cervix. There's a little, like a little structure, like muscular structure to close off. And then it leads to the vagina. Okay. And then out. Muscles. Since we're here. Oh, we didn't. Yeah, you guys have already cut your muscles. But just superficially, we've got the gracilis here, sartorius here. Okay, and then the other cat, they were bisected, so they were able to expose the quadricep muscles up in this region and the hamstring muscles in this region, as well as an adductor muscle, once we are able to expose those. As far as muscles up here, we've got the triceps, the biceps, of course the pectoralis here. If you, again, like I said, if I ask for a pectoralis muscle, I'm not going to ask you to tell me if it's superficialis or profundus, just pectoralis is fine. Okay. The latissimus dorsi is here, this muscle here. You did a nice job bisecting that to expose the intercostals underneath, between the ribs, there and there. Again, there's still some connective tissue here, so they're not as quite as, the striations are not quite as clear, but that's where they're located, okay? And then we've got, that's the latissimus dorsi here, pretty, so pretty, obliques there. And then of course the rectum abdominis, I will not ask because we've cut through them. So that's the rectus abdominis there. Okay, I can't think of any, is there anything that I'm missing that you guys can think of? Okay, if you are back at your table and you're like, okay, wait a minute, where did she say the pancreas was? You know, and nobody in the group remembers, then call me over. Okay, or if you're all kind of questioning yourselves, call me over for clarification. Okay, if you could go through this like I just did, you're gonna get an A. Okay, if you could easily just go boom, 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 and that does that, and that does that, and that does that. Okay, then you'll be in good shape. Okay, I did tell you a lot of things I will ask on